Hello everyone, welcome to the latest webinar from our Queen Elizabeth Scholarship Program in Strengthening Health Systems, brought to you by the McMaster Health Forum at McMaster University in Hamilton, Ontario, Canada. For today's webinar, I'll provide you with a little bit of information on the McMaster Health Forum, the Queen Elizabeth Scholarship Program, and the current version of the scholarship here at the Forum. I'll then turn things over to our incoming scholar, who's Chinwe, who is visiting us from South Africa, and her presentation is on vaccine availability and stock management in primary healthcare facilities in South Africa. Here at the McMaster Health Forum, we aim to be the leading hub for improving health outcomes through collective problem solving. We harness information, convene stakeholders, and prepare action-oriented leaders. We act as an agent of change by empowering stakeholders. The current Queen Elizabeth Scholarship Program is run by a partnership between the Rita Hall Foundation, Community Foundations of Canada, Universities Canada, and individual Canadian universities. The purpose of the scholarship program is to activate a dynamic community of young global leaders across the Commonwealth to create lasting impacts both at home and abroad through cross-cultural exchanges encompassing international education, discovery and inquiry, and professional experiences. The current version of the Queen Elizabeth Scholarship Program that's offered here at the McMaster Health Forum is called Strengthening Health Systems. Our scholars will contribute to strengthening health systems and become part of our large and growing network of health system leaders. The Forum's current QES program has had 3 cohorts of students. The first cohort, that you can see on the screen here, comprised students who mainly went away or visited us in the calendar year of 2016. Our second cohort of scholars, which comprised 22 students, primarily engaged in their scholarship in the calendar year of 2017. The third and final cohort of the current version of the Queen Elizabeth Scholarship Program here at the McMaster Health Forum primarily went away or visited us in the calendar year of 2018. Today's presenter comes from the large group of incoming scholars who worked with us in the spring and summer of 2018. Today's incoming scholar presenter is Chinwe, who is a Nigerian citizen, but she's working on her PhD at Stellenbosch University in South Africa. Her research is aimed at assessing vaccine availability and effectiveness of a stock visibility tool for improving vaccine stock management in primary healthcare facilities. Chinwe wishes to learn how research evidence can be effectively used by policymakers in decision making. Chinwe, over to you.
Good morning, everyone. My name is Chinwe Iwu. I'm a PhD student at Stellenbosch University, South Africa, and I'm being supervised by Professor Charles Waisonge. So I will be presenting my PhD work. At this point, I'm still at the proposal level. And this presentation would take this outline. Immunization has contributed immensely to the reduction of deaths in children due to infectious diseases and has made substantial contribution to human development. The success of immunization programs depend largely on a well-functioning supply chain. Effective vaccine stock management is one of the criteria for a functional vaccine supply chain. And it is very important to maintain complete and accurate records of vaccine stock transactions in order to maintain the quality of vaccines, prevent vaccine stockouts, and ensure that vaccines are constantly available. The WHO defines stockouts as the complete absence of medicines, health products, or vaccine at the point of service delivery to the patient. Global data analysis showed that most low and middle income countries performed below the minimum standard for vaccine stock management between 2009 and 2014. And there is an upward trend in the number of countries reporting stockouts. For example, between 2011 and 2015, a study showed that 1/3 of countries in the WHO region experienced at least one stockout of at least one vaccine for at least a month. In South Africa, vaccine shortages were observed in about 60% of facilities during the post-introduction evaluation between 2009 and 2011. And the most vulnerable groups actually suffer most from vaccine stockouts. These are the poor and those living in rural communities because they depend on public facilities for their health services. When vaccines are not available, this forces parents and other caregivers to make repeated and costly trips to health facilities. This could also lead to missed opportunities for vaccinations as mothers may not be able to pay repeated visits to these facilities. Another impact of this is the measles and diphtheria outbreaks which have been observed in several parts of South Africa, and this could be attributed to missed opportunities for vaccination. And ultimately, immunization targets are not met. Universal health coverage remains an elusive dream, and lives are lost in the process. To reduce the frequency of stockouts of medicines and vaccines, the National Department of Health in South Africa created the stock visibility solution. The SVS, as you can see on the right, is a mobile health application, and it is designed to enable health facilities monitor and capture stock levels on a daily basis. This intervention has been piloted and it has been shown to be effective in reducing vaccine stockouts. However, there are still reported cases of vaccine stockouts in primary healthcare facilities within the country, and no assessment has actually been done on this tool, as well as the vaccine stock management procedures in the Eastern Cape province. So the objectives of this study, actually this study is divided into two phases. The first phase of this study would be a systematic review that would aim to identify approaches that have been used to improve vaccine stock management in various settings, and then to assess the effect of these approaches for vaccine stock management, and to discuss their applicability to low and middle income countries. These will be followed by empirical research in primary healthcare facilities in the Eastern Cape province of South Africa. And this part of the study would involve both quantitative and qualitative study. The quantitative study would involve the use of surveys and document reviews, and we would assess the vaccine stock management procedures in various facilities in the Eastern Cape province. Another objective of the study would be to establish the level and frequency of vaccine stockouts in these facilities. And we would also assess the effectiveness of the SVS in reducing vaccine stockouts. The qualitative aspect of this study would involve in-depth interviews, and we would interview the stakeholders and get their views and experience using the SVS. The anticipated benefits of this study, I hope that this study will provide crucial information for immunization program management on the current situation with vaccine stock availability and management in selected facilities in the Eastern Cape province. This study would also help to provide an understanding of the potential contribution of vaccine shortages to the levels of immunization coverage within the province. The study would also provide an objective assessment of the effectiveness of this tool that the government has provided, in detecting vaccine stockouts and may further help in modifying the SDS as appropriate. Study findings can be used to inform policy on improving vaccine stock management in South Africa and other countries. And my thesis would actually follow the framework that I learned in this workshop, bearing in mind the health system arrangement. Since there is need for immunization policymakers and program managers in South Africa to understand whether research evidence about vaccine stock management approaches can be applied to the setting, I came up with the following questions to guide assessments of the applicability of the findings. And based on what I learned from the forum, I came up with the following questions. And the first one is, were the studies included in the systematic review conducted in low-income settings, or were these findings consistent across settings or time periods? Are there important differences on the on-ground realities and constraints in the Eastern Cape that might substantially alter the visibility and acceptability of the effective vaccine management approaches? Thirdly, are there important differences in the health system arrangement that may mean an intervention could not work in the same way? Are there important differences in the baseline conditions in the Eastern Cape province that might yield different absolute effects, even if the relative effectiveness was the same? What insights can one draw about the different approaches, their implementation and monitoring and evaluation? So these questions would actually guide me as I prepare for my field work and also in my write-up. These are some of the references I used for this presentation. And I wish to acknowledge Professor Charles Waisonge, who is my supervisor and who has been very supportive in this project. I wish to acknowledge the McMaster Health Forum for giving me this opportunity to learn, and my fellow Queen Elizabeth scholars. Thank you very much.
For those of you who are able to make it here today to watch the presentation in person, I want to thank you for coming out. For those of you that have watched the video later on YouTube, thank you very much for taking the time. Before we leave you today, I just want to take a minute to go over a couple of the links that are on the screen to provide you with additional information about our program and what our scholars have been doing. If you're interested in the Forum's Queen Elizabeth Scholarship Program, either the current program, which is ending in 2018, or the new program, which is actually being launched in mid to late 2018, I would encourage you to please click that first link. That will take you to the information page at the McMaster Health Forum's website and tell you all the information you need to know about our Queen Elizabeth Scholarship Program in terms of how to apply and how to be involved. If you're interested in other presentations and webinars by our Queen Elizabeth Scholars, I would encourage you to click on that second link. There you'll find all of the current webinars that have been done by all of our Queen Elizabeth Scholars, and future webinars that our scholars will be doing will also be posted there. And thirdly, you'll see that there is a link for our scholars blog page, which is machealthforumscholars.com. Our scholars write blogs about personal reflections about their experiences while abroad or when they visited Canada if they were an international scholar. So please visit that page and read some of the blogs that our scholars have posted. Feel free to follow us on Twitter at MacHealthForum, and please follow the hashtag QEScholars so you can see all of the fun and exciting things that scholars have been doing from multiple universities around Canada. Thank you for joining us, and we'll hope to see you again soon.